Kevin Sartin with Knob-Nostril Physical Therapy. Today we're going to be going a little bit more in depth on disc pathology. A disc injury can occur whenever there's enough compressive forces that go through the spine to cause the disc, which is the cushion between our vertebrae, to push posteriorly or backwardly and come in contact with a nerve. So you can see this here on the spine by this red colored disc that's pressed backwardly, bulged out, and coming in contact with the nerve. So that'll cause symptoms that'll go down the leg, typically in a dermatomal pattern or a specified pattern based on the nerve that it's coming in contact with. A disc injury will typically occur in individuals that are under the age of 50, and you'll get leg symptoms whenever you're doing activities that increase compressive forces. So what are these activities? The number one thing that'll cause that disc to creep backward and come in contact with that nerve is a flexion movement, so where we're bending forward at the spine, especially if we're bending forward and we're lifting something in the process. So if we're lifting with poor form, that's really going to cause that increased compression and cause those symptoms to increase. So do reference a previous video on lifting, about deadlifting, where we're using more of a hip hinge technique to lift items, which will help alleviate those compressive forces that'll cause those symptoms to go down the leg. Other things that'll cause an increase in compressive forces are sneezing, coughing, pooping. All those things can again cause those symptoms to increase. So now that we know what will aggravate it, let's learn what will help alleviate it. Well, what aggravates it? Bending forward, flexing. So it's not rocket science. So what should alleviate it is the opposite. So extending backward should help alleviate that compression and help take that disc pressure off the nerve and improve those symptoms. So the first movement I'll show people to do is simply bending back. And I'll just have them bend backward a little bit. What you don't want to do is bend all the way back at that inner extension. It might help the disc, but it is probably going to lead to some other issues down the road, which we don't want you to have to deal with. So just do a little bit of extension and it should be just as effective. Another, not exercise, but position that you can do, you're just going to simply go against the wall. Your feet are a little bit away from it. Just lean against the wall like this. So again, we're in that extended position. It's a little easier to maintain that position than just doing the extension standing. So you can hold that one for a little bit longer to hopefully help alleviate that compression and help with those symptoms that go down the leg. The last thing that I'll tell people to do is laying on the floor. So I'll just have someone lay on the floor. Typically, maybe someone's had a long day at work or something and those symptoms are really humming down their leg. Go home, lay on the floor, put something underneath your chest where you're propped up a little bit so you're kind of in an extended position, and just lay there. You can watch TV for an hour or so, maybe watch some of these amazing knob-nostril physical therapy videos, and hopefully that'll help alleviate those symptoms that you're experiencing down your leg. So what we went through today is just a sample of what you can try to help relieve your symptoms. There's a lot of other exercises that can help as well. Manual therapy is super beneficial in relieving these symptoms. So if these don't quite fix your problem and you feel like you could benefit from physical therapy, please visit our website at KNPT or give us a call. We'd love to help you out if we can. Thanks.